winners, I just wanted to say every year we are looking for people to think of those around them that do amazing work, whether that's an emerging leader who's mentoring and growing capacity of others, whether it's someone middle of their career who's really helped to be involved in capacity building, or whether it's those in their senior in their careers who have led outstanding research. All of these areas are really important to recognise, and it's a really well, it's a wonderful part of our job. So I just wanted to encourage all of you, if you have peers or colleagues that you feel should be nominated, please do look out for medals and awards next year, and particularly those in endemic countries, particularly those in niche diseases, particularly those from the non-traditional disciplines. We look for success across all areas of our work, all types of disease and discipline, and we really want to congratulate and recognise that success. So what we're doing this year is we're going to be doing it through a video. We've asked the people that nominated our awardees to say a few words about why they put those people forward, and then we hear a very brief set of words from the awardees themselves. So I'm going to just run you through very briefly the medals and awards that we'll be providing today. So first of all, the Chalmers Medal is going to be awarded. This is for those that are middle of their career, and it recognises mentoring and professional development of junior investigators, and also the capacity building of that audience as well. We'll then hear about the Donald Mackay Medal. So this is awarded annually, and we do this in partnership with the American Society of Tropical Medicine and Hygiene, and we take it in turns each year to present the award. And this is for people who've shown outstanding work in tropical health, especially related to rural or urban health workers. The third award that we will be presenting today is the Emerging Leaders Award. This is relatively new, it's given out annually, and it recognises significant contributions in leadership, in mentoring and in capacity building. The fourth is our George Macdonald Medal. Now this is in partnership with the London School of Hygiene and Tropical Medicine. This is awarded every 3 years, and it recognises outstanding research which has led to the improvement of health. And our last but not least, the Hemingway Awards. This was started last year. It's a biennial award, and it's in partnership with the Liverpool School of Tropical Medicine. It was established to celebrate the work of Professor Janet Hemingway in translational research, and it recognises success in this exact field of work. So the nominators and awardees have joined us virtually from around the world and pre-recorded their messages for you. So I'll introduce them now to share the great news of the winners for this year. Thank you.
It is a pleasure to introduce Dr. Katarina Kranzer, who over the past 15 years has worked across Europe, Southern Africa, and Central Asia on tuberculosis. She undertook a Wellcome Trust funded PhD in TB epidemiology at the London School of Hygiene and Tropical Medicine, being based in the Western Cape in South Africa. For her doctoral thesis was awarded the Woodruff Medal for the most outstanding and clinically relevant PhD. Following completion of her specialist training in clinical microbiology, she served as the research and clinical director of the National and Supranational TB Reference Laboratory at the Leibniz Research Center, Borstel, Germany. She had a mandate to strengthen research and laboratory capacity in high MDR TB burden countries, including Sierra Leone, Ghana, Moldova, Azerbaijan, and Armenia. She contributed to several European Centre for Disease Prevention and Control-led studies, including an extensive MDR-TB outbreak investigation among migrants. Her research has directly influenced healthcare policy and informed several WHO guidelines. Examples, specifically systematic screening for active TB and management of latent TB infection. She has co-authored national childhood TB guidelines for Germany, Austria, and Switzerland, been a member of several WHO guideline groups, and co-member of the WHO European Laboratory Initiative. And she is a member of the WHO Super Reference Laboratory Network. Katarina never does things by halves. She has 2 master's degrees, 2 research degrees, an MD and a PhD, and 2 specialist clinical qualifications. She has co-authored more than 140 peer-reviewed publications. She's currently an associate professor at the London School of Hygiene and Tropical Medicine and is based in Zimbabwe. She was heavily involved in addressing an extensive typhoid outbreak in Zimbabwe. She specifically investigated the effect of the new conjugate typhoid vaccine on reducing transmission, demonstrating the effectiveness of the strategy. She's currently investigating the impact of the typhoid conjugate vaccine on antimicrobial prescribing and resistance in Zimbabwe. She also leads several multi-country studies aimed at improving TB diagnosis strategies in sub-Saharan Africa. And she is the PI in Zimbabwe of a large multi-country consortium investigating the cause of febrile illness in Africa and Asia. Her contribution to science was recognized by the International Union Against TB and Lung Disease in 2019 through an award of the 2019 Union Scientific Prize for Outstanding Research on Lung Health in the past 5 years. As well as her contributions to science, Katarina has a skill for identifying those who have a passion for pursuing science, and she has mentored many masters and doctoral students. Notably, however, she's one of those rare individuals who focuses not only on those in the academic stream, but those often forgotten members of research teams that are critical to research success, but don't receive much attention. These include data, laboratory, and field staff. I am witness to how her commitment to and passion for supporting the growth of others has changed the lives and trajectories of many individuals wherever she has worked. I would like to thank the Royal Society for Tropical Medicine and Hygiene for recognizing her achievements by awarding her the 2020 Chalmers Medal. Thank you.
Good morning from Zimbabwe. I'm extremely honored to be receiving the Chalmers Medal, which acknowledges the commitment to mentoring and capacity building of junior colleagues. I have, and I still am, benefiting from the mentorship, support, and advice provided by senior colleagues, but also peers and juniors. I feel grateful to all my colleagues who have invested time and effort in me and my professional development, making me the person who I am today. I feel really excited that I continue to learn and grow. Having received mentorship and support throughout my career, I feel passionate about capacity building and ensuring professional development of junior researchers, students, but also research administrators and the bigger research team. I really would like to thank specifically my colleague and friend, Rashida Farand, who nominated me, for her support and for sharing my vision of capacity building. I would also like to thank Professor David Maybe for his continued support and all colleagues at the London School of Hygiene and Tropical Medicine for their emphasis on teaching, training, and capacity building. Importantly, none of our work would be possible without our outstanding team and colleagues in Zimbabwe. Thank you to the Royal Society of Tropical Medicine and Hygiene for awarding me the Chalmers Medal.
Professor Eleni Eklilu is an outstanding Ethiopian tropical pharmacologist whose life exemplifies commitment to the Global South. Her research is centered around optimizing drug treatments for ethnically diverse Black African populations, and her approach epitomizes individual and institutional research capacity building. She combines an extraordinary work ethic with genuine passion to bring about lasting changes in global health. Over the past 2 decades, she has investigated pharmacogenetic and environmental differences in drug metabolism and treatment outcomes in a range of communicable and non-communicable diseases in populations in sub-Saharan Africa. Her work focuses on major infectious diseases classified as public health problems in these countries, including concomitant TB and HIV infections, HIV and malaria infections, and neglected tropical diseases, specifically lymphatic filariasis, schistosomiasis, soil-transmitted helminths, and onchocerciasis. Professor Eleni's research projects are designed to fill knowledge gaps and provide evidence-based recommendations for global and national policymakers. Very specifically, her work has contributed to WHO policy change around the timing of ART initiation and dose optimization for efavirenz in patients co-infected with TB and HIV. Professor Eleni has secured numerous competitive external research grants from a range of national and international research funding agencies, including the European Union Horizon 2020 via the European and Developing Countries Clinical Trials Partnership, the Swedish Research Council, and the Swedish International Development Cooperation Agency. She's currently principal investigator and coordinator of 2 EDCTP-funded projects entitled Proforma and Pregart, which include researchers from 12 partner institutions. Professor Eleni Eklilu has understood the vital importance of building individual and institutional research capacity ever since studying for her PhD in the Institute of Environmental Medicine at Karolinska Institute. She has provided training opportunities to 27 PhD students from sub-Saharan Africa to date. Currently, a total of 10 postgraduates, 7 PhDs and 3 MScs are being trained to serve as part of the future pharmacovigilance expert regional task force in Africa. The reach of her mentorship expands far beyond these students through her role within the African Academy of Sciences and research collaborations such as Pregart and the Centre for Innovative Drug Development and Therapeutic Trials for Africa. The number of former students now in research collaboration with Professor Eleni is noteworthy and speaks of an outstanding capability to nurture and develop talent across Africa. Alongside her role at Karolinska as Professor of Tropical Pharmacology, Senior Research Scientist and Research Group Leader, Professor Eleni Eklilu contributes widely to a number of collaborative partnerships. She is currently board member of the Swedish Research Council Committee for Development Research, where she fulfills the Donald Mackay Memorial Fund role of reminding governments of their responsibilities in tropical medicine. Building on her former role as head of R&D at ePharm, the pioneering pharmaceutical company in Ethiopia, she has links with state and private pharmaceutical providers across East Africa. She now serves on the board of directors of the Rwanda Food and Drug Authority. In summary, Professor Eleni Eklilu is an innovative scientific leader, an inspirational mentor, and an outstanding role model to young African scientists. Thank you to the Royal Society of Tropical Medicine and Hygiene and the American Society of Tropical Medicine and Hygiene Grants and Awards Committees for recognising Professor Eleni with the Donald Mackay Medal.
Ladies and gentlemen, I'm truly honoured and grateful to be the recipient of the 2020 Donald Mackay Medal. I thank the Royal Society of Tropical Medicine and Hygiene for recognizing my work and awarding me with this prestigious and incredible award. I thank Professor Gail Davey for nominating me. It's a humbling experience, encouraging and overwhelming to have my work recognized in this way. This is clearly one of the most significant events of my professional career. It's a result of our extensive clinical pharmacology research and pharmacogenetics research to improve the treatment outcomes of HIV, tuberculosis, malaria, various neglected tropical diseases. It has been a great experience working as a clinical pharmacologist in the field of tropical medicine and global health during the past 2 decades. I want to acknowledge the work of everyone in my research group, my former and current PhD students, and thank all who contributed to this success. I acknowledge the work and commitment of my research collaborators from various universities in Ethiopia, Kenya, Tanzania, Rwanda, Uganda, and Sweden. It has been a great pleasure working with all of you. So many of you have contributed to my personal and professional growth, and this award is for all of you. I simply say thank you, and you know who you are. I want to thank important people who influenced my life so much. My parents who gave me the education and encouragement I needed to succeed. My family, my daughters, Betty and Maria, whose support and encouragement meant the world to me. Finally, I thank my research staff, friends and colleagues. So thank you all once again for honoring me with this prestigious award. Thank you.
Thank you for the Royal Society of Tropical Medicine and Hygiene for giving me the opportunity to introduce the Emerging Leaders Awardee. It is with great pleasure to introduce Mr. Hemingway Awards. He is an early career epidemiologist with keen interest in researching about novel health systems approach to prevent transmissions of infection disease from pregnant women to neonates. His career started with World Vision, where he worked with a team implementing a geographical information system to visualize with World Vision Ghana interventions across the country. Executing this assignment to distinction, he then moved to USAID Malaria Care Project, where he worked as a research, monitoring, and specialist supporting quality improvement for the diagnosis of treatment of malaria in northern belt of Ghana. After a year of this project, he transferred to another organizational project leading evaluation and learning efforts. In 2016, he was awarded a Commonwealth Shared Scholarship to undertake a Global Health Master's degree at the Queen Margaret University in Edinburgh. After completing his study, he took up a field epidemiological position with RBC Foundation in South Sudan, mentoring and working with field assistant to design, implement and evaluate different models to control transmission of infection during pregnancy among pastoral pregnant women. He is currently the technical lead of Research, Monitoring and Evaluation Department of the Crossroot organization, Village Health Works in Burundi. His professional goal is to strengthen the quality of epidemiological research in resource-poor settings in sub-Saharan Africa via effective mentorship and capacity building of local colleagues, especially those located in fragile settings. As such, for the past 8 years, he has built capacity of different teams in Ghana, South Sudan, and Burundi on several assignments. He has also created the Kibutu MNE Institute and led the training of 32 clinical and program staff on different topics partnering the epidemiology, health system, and global health evaluation. Emmanuel has strong knowledge and skills in innovative study design, data collection, statistical analysis and reporting to make strategical planning decisions. This is demonstrated in a recent difference in different quasi-experimental evaluation conducted with which he worked as a co-principal investigator, mentoring and working along with 5 local epidemiologists in collaboration with Demographic Health Survey Office, ICP International. Aside those, he has conducted and volunteered for several organizations, including USAID-funded projects, World Bank-funded projects, and Global Partners for Development. He has authored 12 peer-reviewed publications, 7 reports, and presented in several international conferences. Thanks.
Thank you everyone for this award, and especially a huge thank you to the Grants and Awards Committee of RSTMH. Most especially, I would like to say a big thank you to all the field and research assistants I worked with whilst in Burundi and in South Sudan. Through working with them taught me a lesson that global health initiatives and innovations will only make an impact if such people are identified, trained, and amplified to take up the task of operationalizing research into practice. The process of doing this also implies that global health discussions should happen at the places where the real action is, that is decentralizing and decolonizing global health. Whilst in South Sudan, I met a young, intelligent, and vibrant man called Brian. Brian showed exceptional interest in developing and contributing meaningfully to global health. He talked about how innovatively we could improve the health of pregnant pastoralists in a humanitarian setting, and especially tackle the cultural complexities that hindered achievement of our program objectives. Although these were intelligent ideas, Brian's ideas would never make it to national discussion, not to talk about international discourse. Excluding him, really, it's not only an equity issue, but also it implies that global health will not capture the most salient things and salient ideas that are on the ground. So therefore, through this award, I intend to bring to attention the voices of people like Brian into the limelight. We need to focus our binoculars on them and grant them the space for participation. We need to really think of decolonizing global health as an emergent issue within our space, especially given the current pandemic. And so as a result of this experience, I would want to dedicate 10% of the award money to contributing to capacity building activities in Burundi early next year. Thank you once again for this honor. It really means a lot to me and to the people I work with. Thank you.
I'm very proud to have nominated Sarah Cleveland, a veterinarian with a passion for One Health in tropical medicine, for the George Mcdonald Medal. Sarah is globally renowned for her pivotal research on rabies epidemiology, which has transformed our understanding of the disease and its control. Her evidence was a major driver for WHO, FAO, and OIE to jointly agree the target for global elimination of dog-mediated human rabies by 2030. Rabies is one of the most terrifying human zoonotic infections, with a case fatality rate close to 100%, the vast majority occurring in children, in Africa and Asia, following dog bites. Sarah showed that domestic dogs, not wildlife, maintain rabies in rural Africa. She demonstrated that vaccination of dogs is feasible and cost-effective and can effectively eliminate canine rabies and hence human rabies. These findings have informed large-scale rabies elimination programs across Africa, Asia, and Latin America. Through her efforts, it is also recognized that indiscriminate culling of dogs to control rabies is not only ineffective and inhumane, but actually counterproductive and promotes spread of the disease. Furthermore, Sarah has not restricted her work and impact to veterinary matters. For example, she showed massive underreporting of human rabies cases in Africa, and through her work, we now know that canine rabies causes nearly 60,000 human deaths globally each year and imposes an economic burden of some $8.6 billion. She has also demonstrated in rabies post-exposure prophylaxis that a switch from intramuscular to a reduced dose intradermal regimen results in significant public health savings and helps mitigate vaccine shortages. Now, One Health is a concept wherein the health of humans, animals, and the environment are considered in one seamless continuum. Sarah is a leader in such research. She shows creativity and insight in developing and applying One Health concepts, which are practical, effective, and pragmatic. These include the first quantitative analysis of emerging pathogens affecting humans, domestic animals, and wildlife. Her focus is to identify disease reservoirs and integrate approaches to surveillance within more effective human and animal healthcare systems. At no time has the One Health approach been more important than during the current pandemic. And Sarah has been planning and actioning work with colleagues in Tanzania to investigate risks associated with potential new reservoirs of the COVID virus in closely interconnected human and animal interfaces. Her current interdisciplinary research focuses on zoonotic diseases in Africa that cause human febrile illness, and these include brucellosis, Q fever, Rift Valley fever, and leptospirosis. She is demonstrating that the substantial impact of these diseases on human and animal health, and thus on rural livelihoods, and thus she is providing new insights on transmission and reservoir dynamics. I'm going to do that one again. Her current interdisciplinary research focuses on zoonotic diseases in Africa that cause human febrile illness, including brucellosis, Q fever, Rift Valley fever, and leptospirosis. She is demonstrating the substantial impact of these diseases on human and animal health, and thus on rural livelihoods. And she's providing new insights on transmission and reservoir dynamics. Sarah is a member of the WHO International Commission for Certification of Guinea Worm Eradication, and she chairs the Animal Certification Group. Working with colleagues, she is developing robust surveillance measures in animals, approaches which will be essential if we are to succeed in declaring Guinea worm eradicated. And through all of this, Sarah remains strongly committed to training and research capacity strengthening in Africa. She has a long-standing commitment to supervising and mentoring numerous African postgraduate students and postdoctoral scientists. So in summary, throughout her career, Sarah has engaged effectively both at grassroots and high level across all sectors, whether they be medical or veterinary researchers, policymakers, partners in industry, or advocates in development. She connects with communities where she works at both a local, regional, national, and international level. And she creates interdisciplinary partnerships to implement disease control measures that are making a real difference in people's lives. It gives me great pleasure to nominate Sarah Cleveland for the George Macdonald Medal. Thank you.
The award of the George Macdonald Medal is such an honour. I'm so thrilled and privileged to share this with Professor Alex Eze. Thank you, RSTMH, very much indeed. We have seen how transformative the award of the George Macdonald Medal has been in highlighting critical areas of tropical medicine, for example, in infectious diseases, maternal mortality in Africa, reproductive health. And I'm immensely grateful to the RSTMH for this very great honour. I'm particularly delighted to receive the award as a representative of the veterinary profession and the recognition of the interdisciplinary contributions to tropical medicine made through One Health. I've been very fortunate throughout my career to have worked with many talented, outstanding, and highly dedicated colleagues in tackling problems of zoonotic diseases. In starting my career in rabies, I quickly became aware that endemic zoonoses typify many neglected diseases of poverty. It's not so much that the diseases are neglected, they have been very well controlled in many parts of the world, but they continue to impose a very high, often invisible burden in impoverished and underserved communities. This burden doesn't relate only to human disease, but also the profound impacts on food security, livelihoods, and well-being that result from zoonotic infections in animals. George Macdonald, of course, led pioneering work in mathematical modelling of infectious diseases and provided important insights as to how social circumstances affected the way people experience malaria and other types of infectious diseases. Today, these both comprise an important element of our work, and I would really like to acknowledge the role of many disciplines in our partnerships. These involve medical and veterinary researchers, but also ecologists, mathematical modelers, qualitative social scientists, and economists. And of course, I don't have time to name everyone, but I really would like to acknowledge some key influences, including Chris Dye, who is my PhD supervisor at the London School of Hygiene and Tropical Medicine, Dan Hayden, Katie Hampson, and Joe Halliday from the University of Glasgow, Blandina Mbago from the Kilimanjaro Clinical Research Institute in Tanzania, Ludovic Kazwala, who was one of the early leaders of One Health at the Sokoine University of Agriculture in Tanzania, and John Crump from Otago University, whose pivotal work on human febrile illness has set the scene for much of our work over the last 10 years in Tanzania. Today, we're all living under the shadow of one of the world's most devastating zoonoses, COVID-19. More than ever, this pandemic highlights important links between human, animal, and environmental health, and the need for expanded approaches to health for disease prevention and control. These approaches are reflected in One Health, and I very much hope that this medal can encourage further the collaboration and interdisciplinary efforts that will be critical for us to meet the aspiration of good health for all. Thank you so very much for this great honour.
I'm very pleased to share with you the citation for the nomination for the George Macdonald Medal, which is awarded to Professor Alex Eze. Alex Eze has decades of experience in African research capacity strengthening, and policy advocacy on a range of leading global health and development issues. He is one of Africa's most eminent and experienced social scientists working in public health. He trained in sociology, receiving a BSc at Imo State University in Nigeria, and in demography, receiving an MA and PhD from the University of Pennsylvania, and has made huge contributions to research capacity strengthening in public health, with long-lasting benefits for health and broader social and economic development in Africa. He was the founding director of the African Population and Health Research Center, APHRC, where over a period of 17 years, he guided the institution to become one of Africa's foremost research institutes addressing population, health, education, and development issues. He initiated and directed the Wellcome Trust-funded Consortium for Advanced Research Training in Africa to strengthen doctoral training and the retention of academics at African universities. Professor Eze's own research focuses on addressing the challenges that come with the growth of slums around the world and the continuing rapid population growth in Africa. Eze's work has highlighted the development implications of African population and urbanization trends. It has underscored the unique vulnerabilities faced by slum populations, and it has divined the systems of education, health, and economic activity that best serve slum populations. He has ensured through his research that slum populations become more visible in national and global reports and data systems. The esteem in which he is held is indicated by his role on a number of Lancet commissions, including the Rockefeller Foundation Lancet Commission on Planetary Health and the Lancet Commission on the Future of Health in Africa. And he co-chaired the Guttmacher Lancet Commission on Sexual and Reproductive Health and Rights. He's also a member of the Vatican Lancet Mario Negri Commission on the Value of Life that began its work in February 2018. He is Honorary Professor of Public Health at the University of the Witwatersrand in South Africa and holds an Honorary Doctor of Science from KCA University, Kenya, and serves on the boards of several organizations, including the International Union for the Scientific Study of Population. He was the first African to receive the World Academy of Sciences Prize for the Social Sciences in 2018 for his contribution to demographic studies of African population, health, and education. Congratulations, Professor Eze, for the receipt of this award. We are delighted to have you here today.
Good evening. I am delighted and honored to receive the 2020 George Macdonald Medal. I would like to thank the London School of Hygiene and Tropical Medicine and the Royal Society of Tropical Medicine and Hygiene for this honor. I would like to congratulate Professor Sarah Cleveland, with whom I'm sharing the 2020 medal. Congratulations, Professor Cleveland. Since the announcement of this award, I have taken some time to understand the work and life of Professor Macdonald. As I did this, two things stood out for me. One was the fact that Professor Macdonald was a great scientist and malariologist, and his work in this area has continued to dominate the field tremendously. The second is the fact that Professor Macdonald was also a social activist. His activism was evident in his constant and continued push for greater investments in research infrastructure and facilities in low and middle-income countries, and the need to train the human resource capacities needed to drive research in these settings. More than 50 years after the death of George Macdonald, you will agree with me that these remain unfinished agendas in low and middle-income countries. We are witnessing the continued erosion of science and knowledge systems in our public policies and programs, and we are paying the price of this with more than 1 million lives lost to the COVID-19 pandemic. At no time is the need for strengthening local, national, and regional research capabilities and capacities in low and middle-income countries more evident than today. For far too long, our development priorities have focused on what one could consider the provision of palliative care to cushion the consequences of poor leadership in low and middle-income countries. I think time is now for us to shift and advocate for a shift in development priorities, where investments in knowledge systems and institutional capacities and capabilities will become a top development priority. This, I believe, will be in line with the concerns that George Macdonald pursued in his life. Again, I would like to thank the London School of Hygiene and Tropical Medicine and the Royal Society of Tropical Medicine and Hygiene for this honor. And I look forward to a time when we can be together to celebrate the award in person. Thank you.
Good evening. My name's Anthony Solomon. I'm an infectious disease physician serving as the Chief Scientist at WHO's Department of Control of Neglected Tropical Diseases and the Secretary to the WHO Alliance for the Global Elimination of Trachoma. I'm really honoured to give the citation for the presentation of the Hemingway Award to Dr. Katarina Kranzer today in recognition of her work to transform the funding landscape for trachoma, a neglected tropical disease that causes blindness in the world's poorest people. In 1993, it was found that single-dose oral azithromycin was effective against the infection responsible for trachoma. And in 1996, the disease was scheduled for elimination worldwide by 2020. This ambition then received worldwide political support through a 1998 World Health Assembly resolution. But after that, progress became pretty slow for some years. By 2011, less than 12% of the global population known to require interventions to eliminate trachoma was actually receiving those interventions. And only about 1,100 of an estimated 2,400 suspected endemic districts worldwide had even been mapped to facilitate planning of district-level programs. Dr. Harper was instrumental in the effort to solve those problems. As the Chief Executive of Sightsavers, an NGO headquartered in the UK but operating in more than 30 countries in Africa and Asia, she had strong links with the UK's Department for International Development and was able to secure a donation of £10.6 million from DFID for the Global Trachoma Mapping Project. Between 2012 and 2016, the GTMP delivered quality-controlled and quality-assured district-level trachoma prevalence data for 1,546 districts in 29 countries. That required the examination of 2.6 million people, each of which was examined by one of 611 field teams that had been formally trained and certified using standardized processes. The outputs represented a population of 224 million people and required the electronic collection and centralized processing of over 60 million data items, then review and approval by the responsible health ministries. All of that's quite hard to do, and the partnerships that were generated through the GTMP between funders, development organizations, governments and intergovernmental organizations like WHO were key to it being successful and now stand as a template for our ongoing work. Having played that critical part in establishing the burden of disease, Dr. Harper set out to secure funding for programs and to deliver the interventions required for elimination. She was a trusted advocate to the Queen Elizabeth Diamond Jubilee Trust, as it first decided to direct its attention to eye health, and then that half their total funding, amounting to about £40 million, should go to trachoma. Sightsavers was also able to persuade DFID to follow their GTMP investment with a further £39 million for trachoma programs. And through a long process of advocacy and sensitization, Dr. Harper focused the attention of the audacious project Investors on Trachoma. In 2018, Dr. Harper delivered a TED talk, which was viewed by more than 1.3 million people and clinched a donation of more than $100 million for trachoma elimination in Africa. This money will prevent vision loss from trachoma in more than 100 million people who currently live in endemic communities on that continent. These are immense contributions. The trachoma field is unrecognizable now from that of 14 years ago when Dr. Harper became Sightsavers Chief Executive. New data announced by WHO in June of this year show that the number of people requiring interventions against the disease has fallen from over 1.5 billion in 2002 to less than 137 million in May, a decrease of 91%. We owe Dr. Harper thanks for a significant proportion of that step forwards and for all the progress that we will continue to make in the next few years as global elimination is finally achieved. Carolyn, many thanks to you from a distance, and I really hope you can celebrate this award. You're an extremely worthy winner. Thank you very much.
Hello. This is just a short message to say thank you so much. I'm so excited to be the first person to be awarded the Hemingway Prize. It's amazing to receive this. The honour is huge. Professor Hemingway is a legend in the field of infectious diseases, and not just within NTDs, which is where I work, but across the whole field of translational science. So fantastic to be a person to receive this first award. Now, I've received this for my contribution to changing the fundraising landscape in trachoma. But make no mistake, the reason that's been possible is the way the trachoma community all works together, whether that be academia or NGOs or big pharma, or indeed the ministries and the communities themselves. It's been amazing to see how they've all come together. The coalitions, the collaboration, it has been incredible. Real drive and focus and belief that this can be done, that we can eliminate trachoma, has really driven everything. And it's made the donors excited. It's made them believe that it's possible. One or two have said to me that, you know, they've funded other programs in development, but never seen such coherence, such lack of people jostling for position, and such a laser-like focus on the end game. Very clear deliverable programs with a common strategy and being evidence-driven. So I think that is why it's been possible to raise money from a whole bunch of philanthropists as well as government. And without that, we would not have been able to achieve that. So I'd like to dedicate this award to all those people who work in trachoma. We're not there yet. We've still got to bring many countries over the line. But I gather that the Gambia has just put in their dossier very recently for assessment by the WHO. So let's hope that we'll be able to celebrate elimination there. And I know there are several other countries getting very close, even though we are, of course, all affected by this pandemic. So once again, thank you so much to the Liverpool School. Thank you also to RSTMH. I shall treasure this for the whole of the rest of my life. Thank you.
Sorry, muted. Well, that was brilliant, and I hope you'll agree we have a very amazing group of worthy winners this year for our medals and awards. We will be inviting the awardees to give a talk at a future RSTMH event, and the medals are currently, well, I think they're probably finished now, being engraved, and the certificates have been written and the money collected, so we'll be passing all of that over to our awardees in the next few weeks if we haven't already. So before I talk to you about a few next steps, and I do realise we've run over, but please try and stay with me just for a couple of minutes. I wanted to do a few thank yous as we conclude the meeting. First of all, thank you to our speakers who have given up their time and taken part in this event. Thank you to Dan for his organisation. And thank you all for attending this meeting. It's been fascinating, and I think we could go on, and I'm sure we will, looking at this area of work in different ways as we move from the event to think about our impact in this field of work. I wanted also to take a moment to thank all of the volunteers that help us in our work. We're a team of 8, which I'll come back to in a second, but we're supported in delivering an enormous amount of work by around 1,000 volunteers, and they help us in lots of ways. They are our country ambassadors in different countries, our student ambassadors. They assess our small grants, our travel scholarship, our abstract submissions. They help us review all of our submissions to our journals, which have doubled in recent months with COVID. They do a fantastic job. We couldn't do what we do without them, and I want to say a big thank you to them. I know that many of you are at the meeting today and yesterday. And the last thank you before I talk about next steps is to the team. If I could ask the team to put their videos on. We're only a team of 8, and we get through an enormous amount of work. I mean, it baffles me when we start to look at our quarterly review meetings, and we bring together all of the work we've been doing. and we think about the next few months, this team is absolutely incredible, and I can't thank them enough for all that they do to help us deliver, hopefully, a great society to you. And whether that's about publishing our journals, delivering meetings like we have today, making sure our members are looked after, making sure that our systems work effectively and efficiently, giving out our small grants, whatever we might do, having our website working well, lots of tweets and posts on Facebook. We do a lot to try and make a dent in these big issues that we all know are so important, and we have to address them. And so we do what we can as a small team to try and achieve that. So the last thank you is to the team for your amazing, amazing work leading up to today, and for all you do. Thank you so much. Thank you, thank you. Okay, so next steps. Just a few things to mention before I just say the last thing that I need to say. If you have people in your networks that need recognition for work they've done, we all know amazing people. This sector is full of incredible people. Please do think about nominating them for the Medals and Awards next year. If you know students, or if you are a student, think about taking part in our student essay competition, which this year is on COVID and it finishes at the end of November. Think about submitting an abstract to our Research in Progress meeting if you're an early career researcher, and have a go at presenting your research, often for the first time. Keep an eye on our newsletter. Early next year, we'll be launching our new wave of small grants. We are now giving out 7 times more small grants than we were 2 years ago. These are grants of up to £5,000 for those across any field or discipline in global health. And it's about the first chance to take an idea or concept through and have a chance to run the budget, run the project, and deliver that before those future leaders go on to much bigger grants and much bigger successes. So please consider early career researchers and professionals that you know, or if you are one, and get involved with the Small Grants Programme to do your first piece of research. So that concludes the meeting, really. If you are a member, please remember to sign up to the online directory to make sure you can continue networking. And there's a network event right now for members, a reception. So you'll find the link to that in the session details on the conference platform, and we're going to start the reception with a few words from our new president, Professor Gail Davey. So please join us there if you're a member. If you're not a member, well, I think you should probably join, and at least follow the newsletter and read what we're doing and see if that inspires you to get involved as part of the team. Okay, so thank you so much for joining us. We hope that this is the start of many conversations around emerging diseases and outbreaks, and we hope that you'll stay with us on the journey in whatever capacity you can. As we've mentioned many times, if you have advice, if you have information to share with us, the team emails are all on the website. We're all here. Do please write to us or call us and just let us know what you feel we should be thinking about or doing better. Your survey will come to you within the next few days on this meeting, so please do fill it in, and the certificate will be coming shortly for CPD if that's relevant to you. So thank you so much. Enjoy your evening, morning, or afternoon, wherever you are in the world, and I look forward to seeing members in a few minutes at the reception. Thank you very much. Thanks.